Hello, this is Dr. Alexander Haskell again, and this time we'll be speaking about Hashimoto's and nutrition. And this is a very important subject because it requires a lot of commitment and determination on your part to follow these guidelines, which I've noticed quite often have a great impact upon how rapidly a person is able to recover their health and move on to the second stage of treating Hashimoto's. The primary food or group of foods in the research showing a correlation or relationship between it and Hashimoto's is gluten-containing foods. Gluten is found in wheat, oats, rye, and barley. Gluten is the major cause of celiac disease being an inflammation of the small intestines, and is also considered by some an autoimmune condition. So what other conditions besides Hashimoto's is gluten associated with, or celiac associated with? One is type 1 diabetes. Another is Addison's disease, which involves the adrenals. Another involves the parathyroid gland within the thyroid itself, also associated with vitamin D deficiency and also an iron deficiency. And then, of course, the autoimmune thyroid condition is associated with celiac and gluten. My experience with people with Hashimoto's and lab testing is that I've often seen people coming in with obvious symptoms of Hashimoto's, and they're having figured out with their health that they felt much better when avoiding gluten. We would do a blood test for Hashimoto's, the TPO antibodies and the antithyroglobulin antibodies, and come back pretty close to normal. And I was sort of surprised, and I began inquiring about this and found out that with several patients, if they went home, the directions were to go home, eat wheat for 3 days in a row, and then we'll recheck your blood. And every one of them came back with elevated thyroid antibodies. And I've seen this also with people in their history, with their bringing in lab tests or lab results for the antibodies and finding out the different dates when the antibodies were high versus the dates in the lab tests when they were low, and finding out that during that time when they were much lower, they had been following a low or a gluten-free diet during that time. So it is, as far as I'm concerned, really essential if you're wanting to follow this program and to get well. You've got to find the means of removing 100% all gluten from your diet, wheat, oats, rye, and barley. And I have had several people express them once we figured it out. This is not necessarily Hashimoto's, but with a person who's very sensitive to gluten, after several months of being off gluten, feeling much better, having a single crumb ingested, which was on a small amount of butter that her son had used with their knife to remove the butter, and left a crumb of their toast on the butter. She went into an aggravation, just a crumb. So this is extremely important to figure out a way to get educated, to find other sources of a grain that does not include gluten. Other things for suggesting for nutrition. One is to keep your blood sugar extremely stable. Part of the lab tests which we recommend as the initial profile would include a fasting blood sugar, and also what's called H1AC. This is your glycosylated hemoglobin, to find out what your average blood sugar has been for the past approximately 90 days. This gives us a very good profile of the type or types of foods that your body feels best on, and we recommend following a certain regime based upon not only your fasting blood sugar and H1AC, but also to do with your levels of cholesterol and also your levels of progesterone and your cortisol. Each of these different important hormones, insulin being one of them, are very important to eventually optimize your health, but also to take any kind of a strain off of your adrenals and off of your thyroid in this first and second phase of recovery. These various lab tests, these levels of blood sugar, levels of cholesterol, progesterone, and cortisol, if we can maintain them at an optimal level, it will help the thyroid and the immune system to recover from Hashimoto's. Some people have asked me about the use of raw foods, and I think that there is a definite place for raw foods, and the primary reason is because raw foods are rich in enzymes, and therefore they almost digest themselves and provide the nutrients that the body needs. Cooked foods that don't have any enzymes requires our bodies to make enzymes, to produce enzymes, to break them down and to assimilate them. Every time the body has to make something or expend energy, it has to come from somewhere. And it puts, again, a little burden upon the thyroid gland to produce hormones that regulate metabolism, and also the adrenals to produce cortisol and the hormones required to regulate blood sugar. So that is a very brief summary of what is to be expected in following a nutritional program to recover from Hashimoto's. Thank you.